Good day, everyone. My name is Fernando T. Saldar, and I am your student nurse for today. So, for today's video, I am going to um, perform a return demonstration about the parental medication. And I have here a syringe, which I will use later on um, for the demonstration. I have also here the black pen, um, gloves, cotton balls, of course, alcohol, and I have here the sterile water. So, um, for this medication, I have here the most important tips, which is wash your hands and to to avoid bacteria. So, to prepare the medication, first we need to get uh, a syringe, and in this step, I am going to remove the cup of the syringe. So, after you remove the cup, um, prepare the sterile water, which I will be using for the medication. So, um, uh, this one is I will use this um, to the arm of the patient. So, first is you need to clean the syringe first, the needle of the syringe. And okay, after that you set it aside. Then you open the sterile water vial. So after that, if you open it, clean the the surface, and next is apply a alcohol at the cotton ball, and then rub it at the top for 30 seconds. Now, after that, is you need to take off the cup of the syringe and then draw some air. Um, After you draw some air, um, chocolate. After you inject the air to the needle, um, um, insert the needle, the vial, and then make sure that it doesn't have um, bubbles. So after that, take a cup and place it again. So after that, you will proceed for your demonstration. So um, I am back again to perform the second medication. So this is for the subcutaneous injection. So I'll need a insulin syringe for this one. So we need to open again the cup of the insulin syringe. The next step is again clean the needle of the syringe, and after that, after you do it, uh, draw some air again with the exact um, uh, demonstration a while ago, and then again And then after that, after you have the water vial to the syringe, sterile syringe, um, close it with your cup, and after that, you will proceed again to the next procedure. So right now, I will be proceeding to the last step of the medication. So for as of the doctor's order, you need to 5 milligrams of morphine sulfate. So it should be divided with the stock on hand, which is 5 milligrams. So um, you need to divide it with a or um, have a um, proper amount of it. So 5 milligrams is multiplied by 1 millimeters. The answer is 1 milliliter. So okay, now again we need to put alcohol in your hand. So now I have the exact dosage that we need. So um, um, we can now um, draw the medication for this vial. So of course, we need to have a syringe. Again, take off the cap of the syringe. So remember that only touch one bar of the um, plunger of this syringe, and then since my syringe is already connected with a needle, so I have to um, separate it, clean it, and then connect again to the syringe. And again, draw some air, and then take the cherry water. And then close it again with a cup. So today we will proceed to our first step of the medication. So first, take the hand of the patient and ask um, his or her name and some other informations. So good day, sir. I am Fernando Salvador, and may I know your name, sir?
Sorry, Enzo Mario.
Okay, Mr. Enzo. I will perform some medication, which is the parenteral medication as ordered from the doctor. So I will um, inject you something in um, your arm. Is it okay, sir? So after that one, after you ask the patient's information name, apply a cotton ball um, in his or her hand. So I'll perform it here so that you can see it. So apply or rub a cotton around his or her arm in a circular motion. So the next step is inject the um, the 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 ordered medication for the patient. So let's proceed to the procedure. So first is remove the cup of the needle or the syringe. The next step is place the patient's hand properly. So make sure that the patient has no discomfort. So the next step is as you apply the syringe into the patient's hand, you need to lay down the position of the needle, then slowly um, push or apply the sterile water. And then after that, as you remove the syringe, you need to have a cotton ball to prevent it from um, um,
from coming out,
from
prevent the blood from coming
to prevent it from the blood flow. So after you um, place the cotton, apply pressure to it, and then circle the um, the area where you injected the patient to avoid um, some to avoid it from touching or rubbing. So for the next step is you need to put gloves, and then prepare your second syringe. So this is the insulin syringe. So um, first is you need to um, wet the um, the part or the area where you will inject the patient, and do it in circular motion. So remove the cup of the syringe, and then so for the next step is place your left hand, and then um, place the needle in a downward position, and then slowly put the needle inside, and then apply. After, take the syringe and slowly put the cotton and apply pressure. So, for the next step is circle again the area that you inject the patient to avoid rubbing. So this is the last step. So again, prepare your syringe. So this is the one that I have the exact dosage. So we divided it. So again, put a cotton ball around the area that you will inject. So do it again in a circular motion. So here, prepare your syringe, and tell the patient to um, uh, uh, behave to avoid discomfort. So again, remove the cup of the syringe, and then prepare to inject. So for this one, place your hand into the area where you will inject. So do it again in a downward position. So slowly inject. After that, apply again a cotton ball and apply pressure to it. So the next step is um, again draw a circle in the area to avoid um, uh, the patient from rubbing or touching.